But first on Fox tonight, the record-breaking COVID surge continues. Good evening, everybody. I'm Ryan Kruger alongside Lindsay Klein, and thank you for tuning in to Fox 46 News at 10.
The North Carolina Health Department is reporting the largest number of new COVID cases in a day since the start of the pandemic. And now local healthcare agencies are continuing to team up to urge people not to go to the ER for COVID testing. Healthcare workers say they are seeing some of the highest volume of patients coming into the ER since the pandemic began, and it's putting a major strain on resources. Fox 46's Sydney Heiberger is live outside Novant Presbyterian tonight.
And Sydney, this is not just an issue in our region, but really across the entire state tonight.
Lindsay and Ryan, that is absolutely correct. And one nurse I spoke to here at Novant Presbyterian says they've seen a steady stream of about 100 people in the emergency department throughout the night last night. Now, the problem is they don't have nearly 100 beds in the emergency department, which means a lot of people are crammed into the waiting area at a time. And obviously, that is an issue for a number of reasons. Most importantly, though, it takes away resources from those having actual emergencies.
Healthcare experts say they aren't surprised by the rapid increase in COVID cases since the Omicron variant emerged. But what they are surprised by is something else entirely.
One of the things that has been unexpected is the number of people who are presenting to emergency departments for testing when they may be asymptomatic, or they really just want to know, hey, can I go over to somebody's place and I just want to prove that I'm negative.
As of Thursday, North Carolina has a record-setting 18,571 new reported cases, with a positivity rate of 22%. And Mecklenburg County health officials admit there's a major problem with testing capacity.
We are very hopeful that we will receive a new shipment of our rapid tests early next week, so we can relaunch the library distribution program.
But as people are desperate to get tests, healthcare workers in ERs say they're overwhelmed with those trying to skirt around long testing lines. And since hospitals won't turn anyone away, wait times in those emergency rooms are higher than normal.
That definitely creates a harder environment for patients that need to be in the emergency department for an emergent issue.
Another surge that's added to an already present COVID fatigue. But health leaders say the only way through is to help each other.
We can do this, and we can get through Omicron the way we got through each of the other challenges, each of the other waves, and that is by working together and being together as we go through this.
Now, emergency department workers say if you're experiencing symptoms like chest pain, severe shortness of breath, other serious, potentially life-threatening symptoms, of course, you should still go to the ER. But they say if you're not having symptoms or just minor symptoms, they're asking you to please go get tested at one of these mass testing sites, your physician's office, or an urgent care. I'm live outside Novant Presbyterian. Sydney Heiberger, Fox 46.
And that's good advice, especially as the COVID surge continues. Let's take a look at the latest data on COVID in the Carolinas. In North Carolina, 18,571 new cases have been reported. That is 60% higher than the previous record set in January of this year. The daily percent positive rate now a whopping 22%, also the highest reported so far. Hospitalizations have doubled over the last month from 1,131 back on November 30th to 2,258. 69% of adults in North Carolina are fully vaccinated. Down in South Carolina, 3,354 new cases have been reported. The daily percent positive rate now at 20%. And right now, 833 people are in the hospital sick with COVID-19, which is 38% higher than it was just 1 week ago. 51% of people in South Carolina are fully vaccinated.